हर प्राणी में साई।
ఆ రోజు నేను బతుకుతానని అసలు అనుకోలేదు. నేను డ్యూటీ నుంచి వచ్చేటప్పుడు బైక్ స్కిడ్ అయ్యి యాక్సిడెంట్ అయిపోయింది. కాన్ఫిడెన్స్ వచ్చిన తర్వాత 20 days కోమాలో ఉన్నానని తెలిసింది. నాకు 2 పెద్ద సర్జరీలు జరిగాయి. నాకు డబ్బు ఇవ్వడానికి కూడా లేదు. కానీ ఈ హాస్పిటల్లో నాకు నయ్యా పైసా కూడా లేకుండా నన్ను బాగు చేసి పంపించారు. నేను ఇలా మాట్లాడుతున్నానంటే డాక్టర్స్, నర్సెస్ నన్ను బాగా చూసుకున్నందువలన నేను ఇలా ఉన్నాను ఇప్పుడు.
కనుకనే వాళ్ళు త్యాగానికి పూనుకోవాలి. కనుక బీదలను చూస్తే ఎంతో ఆప్యాయంగా వాళ్ళని దగ్గర చేర్చాలి. అది ఏ నిజమైనటువంటి యొక్క దయా ప్రేమలు. కనుక ఆ ప్రేమను మీరు పెంచుకొని.
Bhagawan Sri Sathya Sai Baba was born in 1926 in a remote village in South India called Puttaparthi. Baba was barely 14 when he renounced home, declaring his mission to serve and uplift humanity. India was reeling under severe hardships during the British rule then. In the parched, unforgiving land of Puttaparthi, the rural poor battled relentless adversity, deprived of even the most basic necessities like food, water, and medicine. His noble mother, Ishwaramma, expressed to him 3 wishes: a small hospital for the sick, especially for the young mothers, a school for their tiny tots, and a well to provide drinking water to all. In 1954, just 7 years after India's independence from centuries of colonization, Baba laid the foundation for the first free-of-cost hospital in Puttaparthi, which then did not even have a proper road, let alone electricity or any other amenity. What began with 1 doctor, 12 beds and 1 volunteer is now a 125-bedded hospital, half dedicated to mother and child care. It is the home of hope and solace for more than 600,000 people from 300 villages in the vicinity of Puttaparthi.
This hospital is verily a boon for this big population residing, as I said, in 12 mandals of this district, because it provides not only free but high quality and loving medical care. It provides not only the state-of-the-art medical service but a state-of-the-heart loving medical care.
There is this one old lady who used to come every time with many teeth pain. She has broken all of her teeth. She is like a beggar in bus stand. But she comes every now and then telling pain on this side, pain here. And whenever we relieve her pain, she feels so happy and she gives that beautiful smile. And second or third time when she came, she was so happy. She brought me 2 glucose biscuits in a cover and slid it slowly into my apron pocket, and she told, "Please have this from my side." I felt extremely thankful and happy for giving me such an opportunity to serve, where you will get such pure love.
ఇంత కంటే హాస్పిటల్ ఏ దేవాలయం కూడా ఉండదు. సో ఆ సాటిస్ఫాక్షన్ చాలా ఉంది. బయట మనీ దొరుకుతుంది, ఇక్కడ సాటిస్ఫాక్షన్, మనీ 2 దొరుకుతాయి. తర్వాత మా ఫ్యామిలీ హ్యాపీగా ఉంటుంది, మేము హ్యాపీగా ఉంటుంది.
This general hospital seemed just a prelude to the big announcement Baba made in November 1990, which was simply breathtaking.
వారిని చూచేటువంటి వారెవరు? పట్టణానికి వెళ్లితే కలర్ నీళ్ళైనా వాళ్ళ ముఖాన్ని కొట్టరు. అలాంటి దురవస్థలను గుర్తించి మనము ఇక్కడ ఒక పెద్ద వైద్యాలయాన్ని నిర్మించాము. బైపాస్ సర్జరీ కానీ, లేక కిడ్నీ మార్చడం కానీ, లంగ్స్ ఆపరేషన్ చేయటం కానీ, బ్రెయిన్ ఆపరేషన్ చేయటం కానీ అన్ని ఉచితంగానే. ఈ ప్రారంభోత్సవం కూడాను అప్పుడే నిర్ణయించుకున్నాం. 91 నవంబర్ 22 ఇది ప్రారంభోత్సవం చేస్తాం.
Exactly a year later, Baba stunned the world as the Sri Sathya Sai Institute of Higher Medical Sciences became the first super specialty hospital in India to offer world-class tertiary care through state-of-the-art medical technology, totally free of charge to all patients with no discrimination whatsoever. It was unfurled by the then Honorable Prime Minister of India, Mr. P.V. Narasimha Rao, on November 22, 1991. For more than 3 decades now, this 300-bedded hospital has provided 4.3 million consultations and 320,000 surgeries and procedures across specialties like cardiology, cardiac surgery, ophthalmology, orthopedics, urology, plastic surgery, and gastroenterology.
నేను ఒకనే కాదు కదా, వేలు కోట్లతో మంది వచ్చి జనాలు అన్ని ఆరోగ్యాలు సౌకర్యాలతో బాగా లక్షణంగా ఇంటికి పోతున్నారు. ఆయనకు ఎప్పటికీ రుణపడి ఉంటాం కదా స్వామి. ఒకవేళ పేదోడు అనేది ఇక్కడ గర్వం లేకుండా ఉన్నోడు లేనోడు అనే సమస్య అయితే లేదు స్వామి. ఇప్పుడు ఉన్నవాడు ఒకటే లేనివాడు ఒకటే, అందరినీ సరిసమానంగా చూసుకోవడం వల్ల ఆ క్లారిటీ నాకు నచ్చింది స్వామి.
Anybody interested to come and work, we allow them to work. Only they should have skill. Then any number of time, 1 week, 10 days, free service if they can give, we will always accept their help and allow them to work in this hospital to get the pleasure of this hospital and grace of Swami.
Baba's indomitable will not only made this hospital sustain and blossom, but also led to the establishment of another similar hospital 10 years later in January 2001 at Bengaluru, inaugurated by the then Honorable Prime Minister of India, Mr. Atal Bihari Vajpayee.
I can honestly say that I have rarely seen a hospital so magnificent, so grand and so breathtaking beautiful as this one.
Amid Bengaluru's tech hubs and corporate bustle, the Sri Sathya Sai Institute of Higher Medical Sciences, Whitefield, stands as an oasis of healing for thousands battling stress, illness, and despair. This 333-bed super specialty hospital offers top-of-the-line tertiary care in cardiology, cardiac surgery, neurology, and neurosurgery. It has treated over 1.9 million patients, performed 28,000 plus cardiac surgeries, and 37,000 plus neurosurgeries, entirely free of charge.
The entire activity of this hospital is patient-centric, where everything that we do here has a bearing on how comfortable or easy it is for the patient to access the healthcare that is to be given here. And it's a very proud moment to say that we have the least mortality and morbidity of patients treated with major problems in this hospital. Our infection rate is less than 0.3%. and our mortality rate is also less than 1.2%.
Over 65% of patients treated at both these hospitals struggle to earn $1 a day.
బాబుకి ఇలా అవడం మాకు చాలా బాధగా ఉంది. మా చిన్నప్పటి నుంచే బాబుకి హోల్స్ ఉండి 3. మా ఏరియాలో ఉన్న హాస్పిటల్ అడిగితే విజయవాడ చెప్పారు, అక్కడ తీసుకెళ్ళాం, కానీ 4 లక్షలు అవుతుందని చెప్పేసి అన్నారు. మేము ఆ అమౌంట్కి మేము తట్టుకోలేకపోయాం. చాలా మందిని అడిగాం. దేవుడికి మాకు తప్ప ఎవరికే తెలియదు. ఒక్కొక్కసారి రోజుల్లో మేము తినకుండా పడుకునే రోజులు కూడా ఉన్నాయి. ఇక్కడికి వచ్చాక బయట స్టాఫ్ ఏంటి, నర్సులు ఏంటి, ఇక్కడ కొన్న డాక్టర్స్ ఏంటి, ప్రతి ఒక్కరు కూడా మమ్మల్ని చాలా బాగా రిసీవ్ చేసుకున్నారు. పిల్లోడికి కూడా ఈరోజు ఆపరేషన్ అయ్యింది, కానీ పిల్లోడి మట్టికి చాలా బాగా చెప్పారు మాకు. మా బాబు ఇక్కడికి వచ్చాక బాగుపడ్డాడు. మాకు అంతకన్నా మించింది ఇంకేం అవసరం లేదు.
मैं बहुत गरीब आदमी, আমি একে এখানে দেখেছি অনেক आदमी आया, मेरे का गरीब आदमी एक नहीं दिए. कोई बात नहीं, मेरा साईं बाबा है ना, ठीक कर दे.
To save patients the expense of follow-up visits, doctors here even offer teleconsultations and guide them on post-operative care. This is done in partnership with the All India Shri Sathya Sai Seva organizations, with a large share of the non-clinical tasks carried out by these dedicated and enthusiastic volunteers. Clad in their distinctive blue and orange scarf, they infuse the hospital atmosphere with waves of selfless service.
जब भी मैं मॉर्निंग में हॉस्पिटल के अंदर आती हूँ तो मेरे अंदर एक अजीब सी एनर्जी होती है काम करने की. उस समय जब कोई पेशेंट को मैं ठीक होके जाते हुए देखती हूँ तो मुझे इतना अच्छा लगता है अंदर से ना, और मुझे लगता है कि 99% यहाँ से लोग खुश होके ही जाते हैं.
The letters which we have collected from the patients speaks volumes about what every patient feels about the doctors, the nurses. They use the word bhalubasha, love. So that's something which they experience, which they say no other hospital in the world is capable of providing this.
मैं खेती करता हूँ, किसान. ये 6 महीने का था, 6-7 महीने का, उसके बाद गोद से गिर गया था नीचे. उसके चलते उसका नस दब गया, और ज्यों वो बढ़ते गया तो उसका गर्दन टेढ़ा होते जा रहा था और पैर में चलने में प्रॉब्लम होने लगा. मैं अपने गांव में ही पूर्णिया जिला में दिखाया था. वो 2-2.5 लाख रुपया खर्चा पड़ेगा ऑपरेशन कराने में, और मेरे को इधर इलाज चल रहा है. इधर मेरे को अच्छा लग रहा है, और इधर सिस्टर लोग का भी बहुत हेल्प मिल रहा है.
This hospital has a College of Nursing and Allied Health Sciences too, offering free education to create skilled and compassionate professionals. In this majestic edifice, there is a general hospital as well, with departments in obstetrics, gynecology, general surgery, orthopedics, ophthalmology, ENT, and urology. All of these managed completely by volunteer doctors from Bengaluru and elsewhere.
I get all kinds of patients in my clinic, poorest of the poor, richest of the richest. But if I am not inclined to this principles and moral and everything, I would see money earning. I don't look into his perspective. I don't become compassionate. I don't look into their feelings. I look only into my feelings. By coming here, I look into my patients, how I can help him out.
These hospitals also lead in the adoption of green technologies. Most of their energy requirements are fulfilled through solar power plants. Rainwater is optimally harvested, and the water used is recycled for various purposes. The hospitals are also poised to turn into zero waste institutions. Under Swachh Bharat Mission 2.0, the Whitefield Hospital has been recognized as a change maker and awarded for implementing best practices in the area of sustainability. With advanced IT systems, they are cutting their carbon footprint to the minimum. The hospitals have cloud-based IT architecture, and the patient information of all these institutions are integrated and centrally located at Prasanthi Nialayam for greater efficiency and privacy.
degree and intensity of application of IT in this wonderful institute founded by Bhagawan. In fact, I was amazed to know that you are rated at level 6 and not more than 0.01% of the hospitals in the world have this kind of a rating. So I rate this as one of the probably the highest benchmarks which other hospitals and other healthcare givers should aspire, because this is the best model you have, where there's a wonderful integration between the technical component, the clinical component, as well as the administration wing.
I have also visited about 50 countries in a professional capacity and observed them both in the developing world, in the most advanced hospitals in the world. I will say that the Sai medical services come out as A1, number one. No patient, no sick patient has to make a choice between their kids' college education or getting treatment. So there should not be a choice for something very important and for them to get better.
In the last 10 years, the hospitals have moved on to futuristic MRI and CT scanners, aiding precise cardiac and neurocare, AI-powered ultrasounds, and enhanced echocardiography for accurate diagnosis. Similarly, the laboratories have upgraded to fluorescence immunoassays for early detection and immunohistochemistry markers for specific identification of the type and grade of tumors. In addition, sophisticated neuronavigation system, ultra-modern heart-lung machines, digital flat panel detector cath labs, and advanced neurosurgical microscopes have strengthened patient safety and outcomes of therapeutic interventions.
This male child from Dibrugarh, Assam, unfortunately born with a very complex congenital heart disease. We meaning whoever is performing this study, he or she is playing God. A little error this way or that way, you can make an inoperable child operable or vice versa. So these are not commonly performed surgical procedures. So this one was done for this child when he was around 3 years of age. Now for the second completion surgery, this study has been done. He gets at least another 2 or 3 decades of more of fruitful life.
स्वामी मुझे ठीक कर दो, मुझे खेलने जाना है.
The Sai hospitals stand on these pillars: universal care, free care, comprehensive care, preventive care. These hospitals foster an environment where the spirit of volunteerism, which is innate to every healthcare professional, finds its most beautiful expression. And this facet is absolutely moving. Loving voluntary care. Here, a constant stream of experts from diverse fields step forward, offering their time, skills, and resources to help these institutions thrive and shine. Baba says, "You are what you eat." Food cooked here is pure and vegetarian. Every meal cooked in the dietary is first offered to God and then lovingly served.
Very proud to tell you that Swami's Hospital has one of the best equipments. State-of-the-art laparoscopy equipments are there, and so many surgeries are being done. I think what I have seen over the years is even for junior doctors, they come, they join as a stopgap arrangement. These girls have stayed on.
Healing goes beyond curing disease. It nurtures the body, mind, and spirit. As a result, spiritual care becomes the subtle yet powerful undercurrent in these true temples of healing.
जो ये हॉस्पिटल टेम्पल ऑफ हीलिंग है, उसमें अपना थोड़ा सा योगदान देते रहें, मतलब एक सागर में बूंद के बराबर है, बट इसमें अगर हम कुछ कर पाएं तो हमें इतनी शक्ति देना, बिना निस्वार्थ भाव से यहाँ पे काम कर पाएं.
అమ్మ ఇచ్చిన లైఫ్ యాక్సిడెంట్తో వెళ్ళిపోయినది. ఈ రెండో లైఫ్ స్వామి ఇచ్చిన లైఫ్ నాకు. స్వామికి నేను కృతజ్ఞతని.
While these institutions offered the best of Medicare to those who came into its portals. What about the extremely poor who cannot afford to even come to these hospitals? Thus was born the Sri Sathya Sai Mobile Hospital in 2006, a hospital on wheels that goes to the doorstep of the illiterate and downtrodden. Equipped with advanced diagnostics like ultrasound, ECG, X-ray and lab tests, it offers completely free care through 300 volunteer doctors covering 15 specialties. It indeed demonstrates an effective model to ease the healthcare burden of rural India.
మొబైల్ హాస్పిటల్ వచ్చిన తర్వాత చాలా సంతోషంగా ఉంది. ఇదే మేము బయట చూయించుకోవాలంటే వేల ఖర్చు అవుతుంది. మాకు ఇక్కడ ఒక్క రూపాయి కూడా ఖర్చు లేకోకుండా, ఇబ్బంది లేకుండా సంతోషంగా చూపించుకుంటున్నాము. బాబా దయతో చల్లగా ఉన్నాము.
Honorable Prime Minister of India, Mr. Narendra Modi, who proudly calls India the pharmacy of the world, commended these initiatives of the Sri Sathya Sai Central Trust during the inauguration of the Sai Hira Global Convention Center in July 2023.
सत्य साई बाबा ने मानव सेवा के लिए अस्पतालों का निर्माण कराया. प्रशांति निलयम में हार्ट अटैक हाईटेक हॉस्पिटल बनाकर तैयार हुआ. सत्य साई ट्रस्ट वर्षों से निःशुल्क शिक्षा के लिए अच्छे स्कूल और कॉलेज भी चला रहा है.
The only currency exchanged in Baba's hospitals is love.
నా ఎయిమ్ వచ్చేసి కలెక్టర్ కావడం. ఈ డిస్ట్రిక్ట్ కలెక్టర్ ఈ డిస్ట్రిక్ట్లో ఉన్న పీపుల్ని బాగా చూసుకోవాలా, వాళ్ళకి హెల్ప్ చేయాలా, సాయిబాబా మాదిరి అనేది నా గోల్స్. ఒక హాస్పిటల్లో ఇలాంటి ట్రీట్మెంట్ ఇప్పించి ఇలాంటి బెస్ట్ డాక్టర్స్ని, ఇలాంటి బెస్ట్ నర్సెస్ని అక్కడ పెట్టి వాళ్ళు పేషెంట్స్ని కేర్ తీసుకునే విధానము అంతా ఇలా ఉండాలా అని చెప్పి వీళ్ళ మాదిరే ఈ హాస్పిటల్ మాదిరే డెవలప్ కావాలని చెప్తాం.
With no billing counter or donation box, what truly sets it apart is the dedication of countless inspired souls from India and abroad.
Today I feel so blessed to be able to take part in the Sri Sathya Sai Mobile Hospital, and the most powerful thing I've seen here is people's reaction to Swami's hospital and the team coming from Puttaparthi with a lot of love. The way they greet us and appreciate Swami's service is absolutely inspiring and moving.
I have been coming to the mobile hospital since last 13 years. I work with all veterans of the field. I learned so much. I feel happy and my batteries are charged. Every time I go on coming until my last breath.
The selflessness of many such inspired souls lead to the manifestation of these sacred realms where love flows endlessly as sacrifice.
Aham sarvanga kamanam